We're back with American Medicine Today, and I'm here to ask Dr. Bonati all of your questions from Facebook. So we're hearing from Edward, and he wants to know about diagnostic imagery and changes in pain. If his pain is associated with degenerative disc disease and it increases his MRI, does that indicate that the disease is progressing? And if so, how often should one receive a new MRI?
The question is not complete.
Okay.
I need to know where is the pain, and I need to know if the pain is just on the back or the pain is on the back and on the leg. If he had an MRI and the MRI shows an abnormality, and that abnormality is that he already had pain before,
sure,
and then suddenly had the pain increases and had another MRI, then probably the other MRI will show some changes. More than anything, if the pain increases, but also goes to the leg or becomes farther in the pain that was before, that shows there's an evolution of the pain.
Okay.
And it's an evolution of the damage, and the damage is getting worse. But I don't know if he has only back pain or he has pain in back pain and leg pain, and I don't know when he got the first MRI and when he got the second MRI.
Sure.
Now, if he had an MRI 3 years ago and now another MRI, probably is some evolution of the damage. Now, if he had an MRI in a couple of months and he has another MRI now, he's feeling worse,
right,
and that means the evolution of the problem is faster and more important.
Okay. And how often should one receive a new MRI?
You need to look at the MRI, and you need to look at the clinic, and you need to understand what the problem is. And once we know what's the problem, it needs to be solved the problem. The MRI is not going to solve the problem. And following the MRI every year or every 6 months or every 3 months doesn't mean that you are going to correct the problem. You need to correct the problem.
Okay, but if somebody's coming to you for the first time and say they have an MRI from a few years ago, isn't that too long?
Depends on the pain. Somebody comes to me and say, I had pain 6 years ago, and this pain is there for 6 years, and I ask the question, is that pain the same or the pain evolved?
Okay.
And then I say the pain before was in the back and now it's in the back and in the leg, then the new MRI is justifiable, but at the same time the new MRI is going to show me already a change of that problem.
Got it.
Okay, and if you have an MRI 6 years ago and you get another MRI now, that means the problem is not so bad, because you're not going to be living with 6 years of pain.
Some people do.
Well, if that's a situation, then that person is ignoring really what's wrong. So needs to realize that needs to be treated.
Okay.
They need to make their mind to treat the problem, not to have
to
MRIs.
cover it up. Okay, so we have Carol, who has arachnoiditis, if I'm pronouncing that properly.
That's correct.
Or epidural fibrosis, and lives in severe chronic pain. Now, she's previously had 4 laminectomies and a dura repair. She was diagnosed with a tethered cord in 2015. Can Bonati help?
Yes. Those are the type of problems that I love to tackle.
Okay, and why is that?
Because I want to show that this technique is not only fantastic to resolve the back problem, but also to correct the problems that everybody say that cannot be corrected. So everybody call about arachnoiditis.
Sure.
Arachnoiditis is nothing more than an inflammatory process that happens usually secondary to a bad surgery.
Okay.
And then the nerves become like a cluster, and that creates an impression on the treating physicians that cannot be treated, because now all these nerves are just in a cluster there, and they cannot move freely, and because of that they have a problem. That's not true.
Okay.
Okay, then arachnoiditis is nothing more than inflammatory process created bad surgery. You correct the bad surgery and the arachnoiditis is resolved. And the same thing with what's the
fibrosis, epidural fibrosis?
Epidural fibrosis is nothing more than an inflammatory process on top of the dura. If you go and clean the panus of the inflammation, okay, and just clean all this area, the epidural fibrosis goes away. But you need to do it. Otherwise, what happens is this lady is suffering of this pain because of these 4 bad surgeries, because of a dural tear problem, and somebody already abandoned her with a bad surgery, and they put the label on her forehead that means incurable. You have arachnoiditis.
And there's one thing here that I've never heard before. It's called tethered cord. What is that?
When the cord is coming down, it's like an extra nerve.
Okay.
Then it's another thing that is nothing wrong to have a tethered cord. What you need to do is you need to understand if the pain is coming from there or not. That person is probably all their life with a tethered cord. There was a kid with a tethered cord, was an adult with a tethered cord, now it's an old person with a tethered cord, and now suddenly it's a problem?
Right.
That's absurd, am I right?
Okay, so basically it's knowing the mechanics of the body and where pain stems from.
You need to understand what is creating the pathology, and you need to correct that one.
Now, Robert has a stinging sensation down his left leg to his toes every day and occasionally down his right leg. And there are times when he cannot even stand straight. Now, the doctor in his hometown says that surgery can't fix him. What condition does it sound like to you, and is it something that could be treated?
He's telling you a very classical radiculopathy. Okay, now the only thing that they are not telling you is where that pain is going. It's going to the front of the leg, it's going on the side of the leg, it's going on the back of the leg, it's going inside of the leg. If he tells you where that pain goes, imagine that he said, I have pain on the back that goes to the hip, goes to the outside of the leg, goes to the outside of the calf and the top of the foot. I know exactly what nerve it is, and I know that nerve is injured.
Sure.
So that's the pain. He's not describing the area, so I cannot say which nerve is saying. But if he gave us the information, he's talking about the radiculopathy. This is totally what we do every day.
So in other words, it's not something that cannot be fixed. It's just you have to go to a doctor that understands the true root cause of the problem.
Yeah, it's funny that other doctors this is classic of medical school.
Right.
If the physician is telling them that there's nothing they can do, he's not going to the right physician. Maybe he needs to go to a neurosurgeon, to an orthopedic surgeon. If he's going to a GP, probably is being lost.
Got it.
So if he has a problem like that, give us a call.
Okay. And on that note, you can reach out to Bonati at 855-267-0482. Feel free to ask us your questions. When you do, explain them in slightly more detail so we know where that pain is stemming from. Is it in your back? Does it go down your leg? Where on your leg? And does it reach into the toes? These are things that can help him properly kind of diagnose or get a better understanding of what your problems are. But again, you can like us on Facebook at the Bonati Spine Institute. And once again, thank you for tuning in to American Medicine Today.